My name is Lisa Hill, and I'm the clinical lead. Oh, somebody calling me. I'm the clinical lead for community mental health pathways and integration, and I've been supporting lots of work around transformation, which is really great to see lots of faces here because I've worked alongside quite a lot of people along the kind of lines of transformation and also working within the community mental health teams as well. So thank you very much for joining us out of what I can only imagine is a very, very busy day. There is going to be a couple of more presenters as well today who I'll introduce once we get a bit nearer to their slot. So I just want to give you a little bit of background about kind of stay in the know and why we and Natasha does a fantastic job of pulling these all together, but why we wanted to kind of pull these together was because we're aware across the partnership that there's lots of really great work happening. So we just thought that if we had kind of an hour of time where we could just really focus on one of the great pieces of work, give people lots of information and hopefully have enough time for a Q&A session, then that's why we thought it was quite good. So I think this is our third one. So our two previous sessions have been, I think the first one was on Ramadan and severe mental illness. And the last session that we had was on community core mental health services. And I think there's a couple of people on this call who presented at that one. And again, that's a great service. So if you don't know anything about core, please reach out. And we can talk quite a lot about core because I've been kind of very much involved in its development. Both of those sessions can be viewed on the partnership website, which I'm sure Natasha will pop the link. It's like we planned that, isn't it? In the chat. So thanks for that, Natasha. Again, as I've said, I think these are quite a good opportunity to bring everybody from the partnership together and also to focus on some of the great work and the ongoing work that we're going to be continually doing within transformation. Because transformation isn't just a kind of, it starts and stops. It's going to be a continuous kind of transformation of services over the next few years. Okay, so why we're making the changes to our delivery mental health services. So I'm just going to go through, I'm sure that I'm talking to people who have been along this journey alongside me, but I guess some of the kind of a short recap that we've had is that over the next few years, we're going to be transforming community mental health services and how they're delivered. The purpose of this is that we are going to improve the way that people with severe mental illness across Bradford, Craven, and how they can start to access services that are in their community. So it's about us kind of going to the communities and not the other way around. This isn't just happening in our area, it's happening nationally, and there's lots of information on the national websites about transformation, and you can kind of, I think NHS England has got lots of information on there. I guess the biggest aim is that we want to ensure that people who access our services from our communities get a seamless service. So I guess what we're trying to do is ensure that we're working truly as a systems wide. So we're not just focusing on kind of NHS, we're looking at local councils, we're looking at voluntary and community sector organisations working together. And we're also starting to act as one, which I'm sure you've all heard kind of that being said numerous times. I guess the other thing as well that we're really focused on is that we can deliver kind of high quality and safe services, and that we're doing everything that we can to keep people happy, healthy and at home. There's been a lot of work that's been happening behind the scenes over the last probably 18 months. And as I've mentioned, we're starting to kind of really showcase some of the services that we've been working on, such as core, such as PHBs. And we're hoping with doing that we can start to ensure that people are seen in a kind of timely fashion, and that we're also able to access care closer to home so that people don't have to kind of wait long periods of time for an assessment or to be supported, actually that they know that they can get that support much closer to home in their communities. You can find out more about the work. I think Natasha will probably put another link on, there we go, to the partnership website. And I know Natasha does a sterling job of updating that when more information, and we're doing a big piece of work over the next few months, myself and Natasha, focusing on some of the projects that we have been working really hard on. So please go to that website because it really is a great kind of wealth of knowledge. So yeah. Right, so I think that's enough from me. We have got a period of time towards the end for questions and answers. So you are more than welcome to put questions in the chat, but we won't necessarily be kind of addressing them until towards the end. But yeah, if you can just make a note of some of the questions. The other caveat to that as well is that if we can't answer some of those questions, then we will commit to take those questions away and we'll provide answers, hopefully in a timely manner. Okay. So you're all here, not to listen to me waffle on, which I can do for quite a long time. We're here obviously to talk about the personal health budgets for mental health. So you will be hearing from Maynaz and from Mandy, who are two of colleagues who we work really closely with in Mind. And they've been really, really pivotal in leading the way for personal health budgets, personal health budgets, and how that we've kind of really set a great example for this piece of work up and down the country. So I'm going to hand you over to those two, who will do, again, much better job of me than waffling on, so they can talk about how they played a key role in delivering this, because this is a really great example of how we've worked as a true partnership with the Trust and with our BCS colleagues. So I'll stop talking, Maynaz and Mandy, and I'll hand the floor over to you.
Thank you for that, Lisa. And yeah, welcome everybody. Can everybody see the presentation?
Yes.
Yep, brilliant, thank you. So today we're here to share our personal health budget journey with yourselves and helping transform the way we support people as they move from hospital back into their communities, not just by funding services, but by enabling people to take back control of their recovery and well-being. There is a voiceover here that I will be presenting to you in a minute. And this is from somebody who received a personal health budget. They wanted a phone, something as simple as a phone, which we all know is really essential as a mobile phone. It's a powerful reminder that small personalised interventions can unlock meaningful change for them.
I am very happy with my phone. I am now able to contact services for support if I need to. This helps me to stay mentally well and enables me to be in contact with a social worker for news regarding my children. I am also able to look for employment opportunities, which keeps my mind busy and gets me out of the house.
So how it started. The pilot launched in February 2024. Bradford collaborated with Health Education England on a small pilot for one-off personal health budgets. Co-production was at the heart of the pilot, bringing voices of VCSE, NHS, social care and lived living experience together. Funding was supported by the Healthy Minds, the mental health section of the Bradford District and Craven Health and Care Partnership to support community mental health transformation, focused on improving trauma-informed approaches and personalising care plans to support people to leave hospital whilst improving choice of care and support in the community, promoting individualised and personalised care from wider provision than commissioned services. So what are one-off personal health budgets? Our personal health budgets are all delivered as a third-party budget to support someone to leave hospital, engage with their recovery or reduce need for crisis and inpatient support. All personal health budgets are provided by ourselves, Bradford District and Craven Mind. We are the delivery partners and approved by Bradford District Care NHS Foundation Trust, who are the joint commissioners. The individual identifies where appropriate the items they would like purchasing, which is then facilitated by ourselves. No funds are provided to the individual and the item or service is delivered to the individual.
This is one of our case studies. Just to make you aware, the name has been changed due to confidentiality reasons. Mariam is a 42-year-old Pakistani British female who was referred for a personal health budget. Jonathan worked with Mariam over a month, which involved 4 contacts to deliver the budget and interventions. These focused on the item, effects on her well-being, supporting referrals and signposting. Mariam was referred due to challenges with her physical and mental health well-being. Items provided were to support her to manage her health symptoms whilst maintaining her dignity, self-care and giving her more control on her living environment. Jonathan explored different options with Mariam, which would support her goals and advocate for her to ensure we could get the best possible outcome. Initial engagement was difficult, but by adapting his approach, they were able to build rapport. Jonathan also provided details of different services from BDC Mind and other relevant services based on their conversations, while also supporting her to complete a wellbeing referral form and provide details on mental health telephone support, crisis support and safe spaces. Mariam stated that her mood was greatly improved by our interactions. It was nice to have a positive experience after many negative ones when seeking support previously. She rated it 11 out of 10 and was very happy with how quick the service was able to support.
This is what the personal health budget journey looks like. So an individual would work with their mental health team, work out what and who matter and who are important to them. This will help them set some recovery goals. One of these may be the personal health budget. So working together, they could explore different options. So if the personal health budget was one of the options that they could have, they would then complete a personal health budget application. So this is whilst they are an inpatient at Lymphian Mount or Airedale. And now we also support with a 3-agency, multi-agency team as well. So if they do have 3 agencies involved, they are eligible for a personal health budget. So it is the What Matters to Me conversation, which is a person-centred conversation to help us understand what's important in somebody's life. Relationships, routines, strengths, challenges and goals. It creates space to talk about what makes a good day, what support really helps, and how a personal health budget could make a meaningful difference to their recovery and well-being. So as you can imagine, from that conversation, we are able to gather lots of different information, their strengths, weaknesses, what they've stopped doing, what they would like to do. This will all then help us in making that informed decision about their personal health budget and what it is they require. Once that has been completed, it will then get submitted for the personal health budget application for approval. Once it has approved, it will then come into our Bradford District and Craven inbox.
Following the approval, Bradford District and Craven Mind will be in touch. They will purchase items or services which have been agreed and provide any help needed. The Bradford District and Craven Mind will provide a number of sessions supporting you following the budget to find support local to you and supporting you identify your goals. We offer 3 face-to-face interventions. Session 1 provides an in-depth understanding of the service member's needs and items they have requested. We discuss how the service member would like to purchase their items, which we encourage the individual to meet us in the community to choose their items, such as shops like Currys, or if their individual is more comfortable choosing the items from our laptops, we can support them in this way. Depending on the service member's preference, we either meet them in the community to purchase the items or we deliver their items to their home, which gives us the opportunity to support the individual if there is any need for assistance with the items. And then session 3 is a meaningful session where we can support the individual with signposting or completing referrals to groups, activities or other services to aid and improve their well-being. Throughout the journey, we work closely with professionals such as care coordinators, social workers and family and friends to provide the best outcome for the individual. Upon discharge, we felt that service members were overwhelmed with information. This is why we introduced the wellbeing packs, as it is information that can be used later on in the date, and it does have the crisis numbers in the little green cards. We have received positive feedback so far. This is a pie chart which provides information over the past 12 months of items we have purchased. The top 5 categories are clothing, furniture, white goods, hobbies and interests, household essentials, and another category. And in this other category, we have purchase items such as sensory items, service cleans, gardening, health and beauty, employment such as CSCS cards and SIA badges, and laptops for education.
The reduction in delayed transfers of care. Personal health budgets have played a crucial role in reducing delayed transfers of care, often referred to as DTOCs, from our inpatient services. These urgent personal health budgets typically come through on the same day or as a planned discharge or within just a few days of somebody being deemed medically or clinically fit. However, discharge can be delayed due to practical or social barriers, such as not having a mobile phone for a follow-up, access to food, a safe bed, or even basic cooking facilities. What makes our approach work is our ability to be flexible and responsive by adapting processes and accepting those last-minute applications, which are the urgent personal health budgets. We've enabled people to leave hospital when planned and safely fit. Without these personal health budgets, individuals would often remain in an inpatient bed longer than needed, which not only affects their own recovery, but also blocks access for others in need of acute care. These urgent personal health budgets don't just support safe discharge, they also act as a gateway. Once someone is home, our community teams can step in to provide a short-term support whilst we work on putting sustainable solutions in place. This includes secondary prevention, which means identifying and responding to early warning signs to stop things from getting worse in practice. They might be providing food, phone access, mental health support right away so the person doesn't end up in crisis again. It's about keeping people well, stable and supported in their communities before they reach the point of needing inpatient care again. So ultimately, personal health budgets have helped us move away from hospital dependencies and towards more personalised community-based recovery pathways.
Our journey so far. So from February 2024 to January 2025, we have supported 316 applications. The personal health budget has contributed to the reduction of 654 bed days. And 28-day readmission rate is 12.7% for those without a personal health budget, and people with a personal health budget have reduced the rate to 1.05%. The personal health budget has supported 1 in 4 people return to their community from hospital. The personal health budget financially saving for reductions in beds has been £507,816. The reduction in carbon emissions has been 65,400 kilograms, and we have signposted to 2,059 community systems support. These are the demographics we have captured over a 12-month period. We'd like to note that there are more male wards in the hospitals. We complete a goal-based outcome on the first session, which helps us to set goals to monitor and achieve throughout the time we support the individual. We have the highest goal-based outcome score for personal health budget at 8.9%. The personal health budget holds the highest outcome across Bradford District and Craven Mind, which averages around 3%. This showcases the person-centred approach our practitioners provide to ensure the service members' goals and needs are met. This slide provides information on signposting and referrals over the 12-month period. We have social support, guideline, non-crisis mental health telephone support, safe spaces, crisis support, food parcels, food banks, public health, pathways to employment, NHS social care referrals, Percy Bilton, REACH, and other is hobbies and interests. This slide shows patient service member feedback. The boots were delivered and are great, so thank you PHB. I've been walking in them all weekend. I am very grateful for the items from the personal health budget. They will benefit by keeping me occupied, and it was good they took the time to research items and come up with alternative suggestions. You have been amazing and so much has been done, so thank you. I have been wanting the garden done for years. Now I can enjoy the garden now. And feedback received from the ward staff. We would like to thank your service for the support you have given us. The response was fast, supportive and very welcoming. Items delivered within 2 weeks on the first contact and will make a significant difference.
So key takeaways from today's presentation. As we conclude, it's important to highlight that personal health budgets are not just about speeding up discharge. They're a foundation for transformation, shifting us towards a more responsive, preventative and personal-led model of care. They enable secondary prevention, protect inpatient capacity, and above all, empower people to recover in the place they know best, their own home, supported by their own community. This has been possible because of how it has been designed through co-production, shared ownership and a collective vision for better outcomes. Back to yourselves for any questions.
Thank you both for that. That's a really great presentation, showing some really good outcomes and how it's really kind of made a really great impression on lots of service users and patients who have used it. Especially for me, what I find really powerful is the signposting as well, because ultimately I know they've been able to buy the goods that they need, but I think for me it's also kind of we've been able to engage people in signposting to different places and different support in the community. So I think that's really powerful. So thank you both for that. Really great. So I think we have got a question. So Kalsoom.
Oh, hi everyone. Yeah, my name is Kalsoom. I'm Mental Health Commissioning Manager at Bradford Council. I just wanted to know what are the amounts of the personal health budgets. What's the lowest amount? What's the highest amount? I guess it's based on their need.
It's £250.
Okay.
That's the cap at the moment. It's £250. In the pilot, it was from £250 to £300, but moving forward, it is now £250 per personal health budget.
Okay, thanks.
Can I ask a further question to that, which you might not be able to answer? I guess what about if the identified need is over £250? Do we have any kind of workaround solutions, or would we just try and be very canny shoppers and try and shop around to try and fit within that budget?
Mandy, I think talk about the Percy Bilton there and how that helps us.
Yeah,
Right.
so we do have Percy Bilton, which is a charity who offers white goods. And there also are other, I think, is it LA funding that's been used before when we've had cleans. So there is other services out there that we can look at to support us as well.
As soon as we identify an area such as that, we will then look into other opportunities. So we've also used sustainable bikes in the past that have been given as a grant for the NHS. So we've tried to link up with other organisations and services to help us. And, you know, it's worked on so many occasions. People have been brilliant.
That's fantastic, isn't it, as well? Because I know as a kind of a care coordinator that sometimes even trying to navigate some of those services is really difficult. So asking our service users to do that, and the fact that you guys are there to kind of support and do that hand holding is fantastic. And it also, again, showcases really great partnership working, doesn't it? That we're starting to build those links so that we can start to build on those networks to get the better outcomes for service users. So thank you. Any more questions? Any other questions or thoughts? Pete, do you want to come in?
Hi, yeah, I just wondered if there's any things that you don't do. I was thinking particularly around services like gas, electric, and sorting out houses that are a mess. I guess there's other grants that can be used for that. But I just wondered.
The things that we wouldn't do is things such as alcohol, tobacco, so those kind of things we wouldn't support. In terms of, sorry, did you say gas and electric? We have supported with the meters. We've helped because again, once they've come out of hospital, they've been discharged. It is quite a lot for them to do on their own. So we do support with that as well. We have rung up companies. We've topped up their meters for them. So yeah, we do support with all of that. However, it is something that we do go back with to the wards themselves as well. It is something that should be identified upon admission. So we do work really closely with the wards to see if there is anything such as that we could possibly do before that discharge date comes closer.
Sounds amazing. Good. Nice one.
Yeah. And just another question from me. Sorry, I will keep hogging the Q&A session. If so, on the slide, I know there's the 3 sessions, isn't there? How do we ensure that the kind of feedback loop to the care coordinator or to whoever's made that referral? What does that look like? How are they involved in some of the discussions? Do they get feedback, or is it that you just support the kind of service user?
I think we normally work very closely with the care coordinator. I'd say most of the time we are in contact with them all the time, or if it's just the first intervention and then the last, we do have face-to-face appointments with the care coordinators. Sometimes it might be a case that the service member wants to do everything over the phone, or they might not be that well, so they've asked the care coordinator to do the intervention with us, so we would work with the care coordinator as well.
Okay, that's good to hear. Thank you for that.
I'll just jump in there,
Yes.
just to add, with the care coordinators, because they've got that rapport and that relationship built with them. We do go to them, or the referrers, because they do know this individual really well. So we do use those relationships to help build our relationships with them as well. And, you know, they usually tend to have more knowledge around the risks or anything, which they do put in. But then, you know, there's triggers and there's things that could change within that discharge period as well. So, yeah, we work really closely with the hospital staff, with care coordinators or other referrers, depending on where the referral comes from.
Fantastic. Yeah, because that obviously supports the service user in not having to kind of tell their kind of story several times, isn't it?
Yeah,
which is obviously
absolutely
what we all want to achieve. So yeah, that's really great to hear. Okay, is there any more questions? No. Okay. Well, I guess then that takes us to me to do the closing remarks. So there will be the recording of this session will be made available, and it'll be on the partnership website. Sorry. If you have got any questions, there is also a form that you can fill in anonymously, and we'll obviously do our best to, as I said at the beginning, to ensure that the best person can answer that, and we'll try and do that in a timely manner so that you've got your answers. But I think for me, the presentation was so good and so clear that you've answered quite a lot of the questions already. So you're ahead of the game, Naz and Mandy. I'm impressed. We did have another up and coming one of these sessions, and I think we had a conversation because it was going to be in the middle of the school summer holidays, so we've decided to cancel that one, but we will be doing another Stay in the Know session probably around September, which feels like a long time away, but it is actually only 3 months, which is scary, isn't it? But hopefully we'll all get a bit more sunshine before we get to that next Stay in the Know. So I hope everybody has a lovely rest of the Monday afternoon. I hope whatever you do this evening, you can enjoy some sunshine. Thanks ever so much for coming, and nice to see a lot of you that some of you I haven't seen for a while. So take care, and I'll catch up with you all soon.